Modern medicine is one of humanity's greatest achievements. But there's an uncomfortable truth most people never hear. Some of the most advanced medical knowledge in history did not come from modern science. It came from the ancient world. Thousands of years ago, long before laboratories, anesthesia, or imaging machines, ancient physicians treated injuries and diseases that still challenge modern doctors today. And in some cases, they succeeded where later medicine failed. This story does not begin in a hospital. It begins in a tomb. In ancient Egypt, medical papyri were buried alongside the dead. These texts were not prayers or myths. They were medical manuals. Detailed descriptions of wounds, infections, tumors, and internal diseases. They listed symptoms, diagnoses, and treatments in a structured, clinical way that looks shockingly familiar to modern doctors. One of these texts, the Edwin Smith Papyrus, describes traumatic injuries with a precision that suggests real surgical experience. It explains how to examine a patient, how to identify damage to the skull, and how to decide whether a case is treatable or untreatable. This is not superstition. This is clinical decision-making. Even more disturbing is what ancient Egyptian surgeons were capable of doing. Evidence shows they performed amputations, stitched wounds, and treated fractures using splints. But the most shocking discovery is this: there is strong evidence of ancient brain surgery. Skulls have been found with holes carefully cut into them, showing signs of healing, meaning the patients survived. This procedure is known as trepanation, and it appears across multiple ancient civilizations. In Peru, skulls dating back thousands of years show advanced surgical techniques. Some even show multiple surgeries on the same individual. Survival rates appear to have been surprisingly high, sometimes higher than those of similar procedures performed in the 19th century. How did they control infection? How did they manage pain? How did they understand anatomy without modern tools? Modern doctors still debate these questions. Now, travel east to ancient India. More than 2,000 years ago, Indian surgeons described procedures that resemble modern plastic surgery. One ancient medical text explains how to reconstruct a severed nose using skin from the patient's forehead. This technique was so effective that British surgeons later adopted it in the 18th century after witnessing it firsthand. Let that sink in. A surgical method developed in the ancient world was advanced enough to be reused thousands of years later. Ancient Indian physicians also described hundreds of medicinal plants, many of which modern science has confirmed contain active healing compounds. Some were antiseptic, some were anti-inflammatory, others affected the nervous system. They didn't know about bacteria, they didn't know about chemistry, yet they knew what worked. Now, move west to ancient Greece. Hippocrates is often called the father of modern medicine, but even he relied on knowledge that was already ancient in his time. Greek physicians emphasized observation, diet, environment, and lifestyle, ideas modern medicine has only recently returned to. They recognized that stress, food, and daily habits influence disease. They understood that the body could heal itself under the right conditions. But here's the mystery. Some ancient treatments disappeared entirely. In the Roman Empire, advanced public health systems existed: clean water, sanitation, hospitals for soldiers. After Rome fell, much of this medical knowledge vanished for centuries. Europe entered a period where medical progress slowed dramatically. Techniques that once existed were forgotten. Diseases that had been managed returned with devastating force. This raises a disturbing question. Was medical progress really linear, or did humanity lose something important along the way? Ancient China adds another layer to this mystery. Traditional Chinese medicine describes energy pathways through the body called meridians. For centuries, Western doctors dismissed them as imaginary, but modern imaging studies have shown measurable differences along acupuncture points. Something is happening in the body.
Science can observe it, but still struggles to fully explain it. Then there are ancient surgical tools. Delicate instruments have been uncovered that appear designed for precision work, not crude tools, but specialized equipment. And then there are medicines we still don't understand. Ancient texts describe treatments for pain, infection, and mental illness that modern pharmacology has not fully decoded. Some remedies worked, others were lost. Here's the uncomfortable reality. Ancient medicine was not primitive guesswork, it was empirical knowledge built through generations of observation, trial, and experience, and much of it vanished due to war, collapse, and the destruction of libraries. Which brings us to the Library of Alexandria. When that knowledge center was destroyed, countless medical texts were lost forever. Entire systems of understanding may have disappeared in a single generation. Modern doctors stand on centuries of progress, but also centuries of loss. Today, medicine is rediscovering ideas ancient physicians already understood. The importance of gut health, the role of inflammation, the connection between mind and body. The past is not as ignorant as we were taught, and the present is not as advanced as we like to believe. So the real mystery isn't whether ancient medicine worked, the mystery is how much we forgot and whether we'll ever fully recover it. If this story surprised you, the next episode will go even deeper into lost medical knowledge the modern world is only beginning to rediscover. Subscribe now, because history still has secrets modern science hasn't solved.